Good afternoon, everyone. I'm Nirav Shah, Director of the State of Maine Center for Disease Control and Prevention. I'm delighted to be able to join everyone this afternoon to provide you all an update on where we are with COVID-19 across the state of Maine for today, Wednesday, January 6th, 2021. I begin today's update on, unfortunately, another sad note. Maine CDC has received the reports of 3 individuals who have died with COVID-19. One of them was a man in his 70s from Cumberland County, and the other 2 were both men in their 80s, both of whom were from Penobscot counties. Their passings marked the 370th, 371st, and 372nd deaths associated with COVID-19 in Maine. I'd like to take a second to offer our deepest condolences to the friends, family members, and communities to all of these individuals who have passed away. Across the state right now, there are a total of 27,090 total cases of COVID-19, an increase of 525 cases since yesterday. Of those, 22,794 are confirmed cases, 4,296 are probable cases. As I mentioned a moment ago, 372 individuals have passed away, and overall, cumulatively, 1,124 individuals have been hospitalized. Right now in Maine, there are currently 191 people who are in the hospital with COVID-19. Of those 191, 54 are in the ICU and 21 are on ventilators. Across all of our 27,090 cases, 2,919 of them have been among healthcare workers. Turning next to where we stand with respect to vaccinations. Overall, as of this morning, 38,065 people have received doses of COVID-19 vaccination. As we've discussed, those numbers can and most certainly have increased even since this morning, given that we know at healthcare centers across the state of Maine, vaccine efforts are underway as we speak. So that number will continue to go up. Finally, turning now to a couple of updates on where we stand with outbreaks. Since I spoke with you last, there are a few outbreaks I wanted to note that Maine CDC has opened up epidemiological investigations into. One of them is at the Pinnacle Health and Rehabilitation Center in South Portland, where we are aware of 3 cases of COVID-19. Also, at the Our Lady of Ransom Church in Mechanic Falls, where we are aware of 4 cases. Also, at the Landing at Cape Elizabeth, a memory care center, where we have received reports of 3 cases of COVID-19. And finally, at the Penobscot County Courthouse, where we have received reports of 4 cases of COVID-19. Turning next to updates on where we stand with respect to testing. First, PCR testing. Our 7-day PCR positivity rate now stands at 6.27% statewide over the past 7 days. Likewise, our testing volume across the state now stands at 477 tests for every 100,000 people. Turning next to antigen tests. Our positivity rate for antigen tests right now stands at 6.82% on a 7-day basis, and our volume of antigen tests now stands at 141 such tests for every 100,000 folks. Before I turn things over to questions, I wanted, as I try to do now, to take some time to answer the questions that each and every one of you has taken time to send to us. I want to make sure that as we are discussing where we stand with respect to vaccines in particular, we are providing and equipping everybody with the latest, most up-to-date, accurate scientific information about what we know around vaccines. Again, these questions are questions that each and every one of you has taken time in different ways to send to me or to our team at Maine CDC. So to answer some of your questions today, probably the most frequent question that we've received since Monday is, are there other vaccines on the horizon in addition to the two that we currently have right now? And the answer there is yes. And I'll just take a quick second to talk about at least 3 of the candidate vaccines that are currently under development or review. The first is actually a vaccine that has received authorization in at least one other country, the UK. And that's a vaccine that's been developed in joint partnership between Oxford University and AstraZeneca, a pharmaceutical manufacturer. They've conducted clinical trials involving at least 65,000 people for their vaccine. Their vaccine requires 2 doses and can be stored in regular freezing temperatures of regular refrigerated temperatures rather, of around between 2 degrees to 8 degrees Celsius. The manufacturer, AstraZeneca, struck a deal for at least 3 billion doses across the globe, even before any late stage results were announced. And that is more than twice as many doses that they have promised to deliver across the globe, more than any other candidate vaccine to date. This vaccine in particular has certain benefits that may make it useful in rural parts of the state, to say nothing of rural parts of the globe. Namely, that it does not require that ultra cold storage that we've seen with at least the Pfizer vaccine. Another vaccine candidate that is under development is one that's being studied by a small biotech company called Novavax. Their vaccine has currently enrolled about 45,000 people. It too requires 2 doses and can be stored anywhere from 2 degrees to 8 degrees Celsius. This company has received several billions of dollars in funding to develop their vaccine. And this will probably be one of the vaccines we start hearing about after the US FDA reviews the AstraZeneca Oxford vaccine. Right now, the data have not been fully published. Indeed, just a few days ago, there was a phase 3, the final phase trial that was announced for this vaccine candidate by Novavax. Like the AstraZeneca vaccine, it too does not require this ultra cold storage environment, making it one that could be particularly useful in rural settings. And the final one that I wanted to mention today is a vaccine candidate that's been developed and is being studied in joint partnership by Johnson & Johnson and their partner Janssen, the biopharmaceutical company. Right now, those trials have enrolled approximately 70,000 people. Unlike the other 2 vaccines I mentioned, this one is unique for 2 reasons. First, it only requires 1 dose, whereas the others to date have required 2 doses. Similarly, it too only requires storage in that 2 to 8 degrees Celsius range, not the -80 range that the Pfizer vaccine does. That one makes this vaccine perhaps the easiest to distribute, particularly in rural settings. Now, just to be sure, Johnson & Johnson is also doing a separate trial utilizing 2 doses, not 1 dose, to determine if there's a difference in the effectiveness of this vaccine with 2 doses, not just 1. Where does all of this take us? What's going to happen next? Well, based on what I've been briefed on, the AstraZeneca Oxford vaccine may be the next one that seeks authorization from the US FDA. The timeline for when that happened is really up to the manufacturers. But late last week, one of the heads of Operation Warp Speed, Dr. Slawi, indicated that it may not be until April before this AstraZeneca Oxford vaccine gets evaluated and even potentially authorized by the US FDA. I will keep everyone posted if and when we learn more about these 3, as well as a number of other candidates that are under development. Probably the second most common question we've received lately is around the second dose. And the bottom line question that's come to us is, well, if all you talk about is how limited the supply is, how do I know, how can I be sure that when my time comes for that second dose, it will be there waiting for me? Let me just put everyone's mind at ease. Right now, no one is giving away any shots, especially that second dose. Everything that we have been told thus far indicates that if you are in that first group of people to be vaccinated, your second dose is already being set aside for you and won't be given to somebody else. Indeed, the general who is heading up Operation Warp Speed, General Gus Perna, has indicated that their plan of operations all along has been to make sure that those second doses are kept in reserve so that they are not accidentally given out and given to somebody else. At the same time, General Perna has indicated that once they achieve stability and predictability with the overall production of vaccines, they will be able to better predict when those second doses may be available. But I just want to put everyone's mind at ease that those second doses are being held in reserve. And so when the time comes, 21 days or 28 days, for those doses to be re-administered for that second round, they are being delivered to the state of Maine so that they can be given out as that second dose. Indeed, this week, we started receiving those second doses of the Pfizer vaccine, given that it has been now 21 days since the first doses came into the state. Finally, a question that's come up quite a bit is how long will it take for the vaccine to work? The bottom line here is that of the two vaccines that we have, you don't get full protection of that from that, you don't get full protection from that vaccine until at least a week after your second dose, based on the clinical trial data that we have. There has been some early signs that you can start to get a little bit of protection after the first dose. But for example, in one study, it only reached about 50% efficacy after one dose, according to a paper that was published in the New England Journal of Medicine. It was only after that second dose that the effectiveness of the vaccine rose to at least 95%. And that too doesn't happen instantaneously, but rather at least 1 week, if not 2 weeks, after your second dose. All told, if you get your first dose on day 1 and your second dose on day 21 or 28, still, even then, it's not until days 28 or 35 or day 42 even, depending on which vaccine you get, until you can be considered to have full protection of the vaccine. Please keep your questions coming. We try to make sure we take a look at those, and for ones that we see recurring, we put them on the list to try to answer directly to you, because we want to make sure that we are answering all the questions that we can, that we know are on people's minds. So bottom line there, please keep your cards and letters and tweets coming. We see those and we will collect all of those and keep answering your questions. So with that, we're going to turn things over to our colleagues in the media. And the first question of the afternoon goes to Jessica Piper.
Hi, Dr. Shah. Thank you. First, on this issue of second doses that you just touched on, does the Maine CDC have numbers for how many people have received their second dose so far? And what are you guys doing to keep track of people and make sure that they're showing up for appointments and all that?
Sure. So Jessica, we do have numbers, but let me emphasize that those numbers are an absolute underestimate. The number that we have as of right now is 18, but I know that number not to be the true number. I can only claim what I can confirm, and all I can confirm is that which has been reported to Maine CDC. Facilities have at least 24 hours after administration to report those numbers to Maine CDC. Indeed, in the retail pharmacy partnership, it's 72 hours, not 24 hours. So the numbers that I get as of 6 a.m. are as of what was reported from Tuesday, which reflects what happened on Monday. So that's just the natural system that we have. So undoubtedly, Jessica, that number is significantly higher by now. But again, I can only claim what I can confirm. What we are doing is, first of all, keeping track of the rate of those second doses. We want to make sure that we see the same parity. The slope of that line of second doses should be, for any given time period, the same as it was for the first dose. That's how we can have some degree of confidence that the rate of second dose uptake is as robust as it was for the first dose. But we're also working with systems because it's the administrator of the vaccine that we trust and depend upon to schedule a time for that second dose, to send out a reminder for folks to come in for that second dose. So a lot of that happens by providers on the ground as well.
All right, thank you. And then how will Maine's travel restrictions apply to someone either in or out of state once they're vaccinated?
It's too early to tell. Generally speaking, although we are delighted to know that the vaccines have shown a high degree of efficacy, 94, 95% for the Pfizer and the Moderna vaccines, how they will affect things like travel and the need to quarantine after return from travel, it really is too early to tell. And in large part, Jessica, that goes back to something we talked about a couple of days ago, which is one of the unknown questions around vaccines is whether they reduce your likelihood of harboring or spreading the virus. There are early and positive signs to suggest that they do reduce that likelihood, but until all the data are in, what we can say is that the vaccines reduce your chances of getting sick, but we don't yet have an answer about whether the vaccines reduce your likelihood of making other people sick. That's an open scientific question. We're hopeful, but right now we don't have the data upon which to base any policy changes.
Thank you.
I'm going to turn now to Mal Meyer next.
Good afternoon, Dr. Shah. Thanks for taking my question. You mentioned during the last briefing that the state was still coming up with who would be included in phase 1B. How could you still be deciding this when these people are in theory up next?
Well, by up next, Mal, I think it's important to note that we are still midway through vaccinating healthcare personnel in phase 1A. That is our focus right now when we want to make sure we get as many healthcare providers and personnel vaccinated right now, and that's our focus. Now, the question of who gets vaccinated as part of phase 1B turns in large part on what the supply of vaccine is in phase 1B. We at the state level are only given maybe 6 days notice about what our doses will be for the next week, to say nothing of the next month. For example, yesterday on Tuesdays, generally, we get a sense of what the following week's distribution will be. The inability to have insight into what might be coming our way more than 6 days in advance means that it's very, very difficult for us to plan for who we should be thinking about vaccinating. Of course, we can think about it, but if it turns out that what we get in February is no different from what we've gotten in January, those plans are going to have to change. We're having those discussions right now, but again, until we know what the supply chain looks like, being able to make predictions about who might be vaccinated next are just that. They are predictions. Until we have security into knowing what we'll get, we can't really make any promises to anybody.
I understand what you're saying about the supply, but then how could other states like New Hampshire, which released its plan just the other day, how could they be determining who and when this might be happening? And states like Maine still have yet to announce this type of plan.
Well, a plan is just that. It's a plan. And in my view, what a plan needs to have is more than just theory. It needs to have practice associated with it. It's easy to come up with plans. That's easy to do. What's hard is to make those plans reality-based. Until we have a sense of what we will get as a state, those plans are just that. They are words on a page without any promise behind them. That's not the way I do business. It's not the way I've done business at any point throughout this pandemic. When we put plans on a page, what we are saying is that we are ready to offer the vaccine. I don't disagree with other states that have taken that approach, but they don't have any more visibility into what they're going to get in March or February any more than I do. All we know is what we're getting next week. When I talk about a plan, what I mean is a lot more than just idle words on a page. I'm talking about a plan to actually implement it. Right now, there's not a state out there that has insight into that. I'm going to turn now to Amy Brown next.
Thank you, Dr. Shah. We've heard that there may be an outbreak at the postal facility in Hamden. Can you confirm that?
I cannot confirm that. we have not received any reports of an outbreak there as of right now, Amy. There may be one, but by the time it's occurred and been reported to Maine CDC, that may be occurring in progress, but I don't have any reports of that, or I can't confirm it right now.
Okay, great. Thank you. We're also getting a lot of questions still about how healthcare workers that are not associated with one of the big healthcare systems in the state, like primary care providers, people in private practice, will be getting their vaccines. Is there any update on that front?
Well, Amy, this is what we released last week, which is to say an outline and a plan for individual healthcare personnel, not just providers, but personnel who are affiliated and patient-facing in some manner. What we have done is work with hospitals across the state to make sure that those hospitals and now FQHCs, federally qualified healthcare centers across the state, are themselves able to offer a vaccine to providers and personnel in their areas, even if those providers and personnel may not, for example, practice at the hospital. That plan's been in place, and that process we know has been happening. There is some degree of coordination that has to happen between those entities, between the hospitals and the providers, to schedule a time to come in. But in conversations with hospitals as well as providers in the recent 24 hours rather, we do know that those plans are being put into place, and we're also accelerating those by furnishing as much vaccine to those locations as we can.
So that coordinating piece, would that be that the independent healthcare provider could reach out to a local healthcare organization and see if they could set something up, or will it be working the other way?
We've seen both in place right now in Maine. I'm aware of one very large multi-specialty practice group that has developed a roster of healthcare personnel and practices in their area, and they're actually proactively reaching out. In other parts of the state, what seems to have worked best is for practitioners themselves to reach out to the hospital systems to find a time and find availability. So we've seen both models be applied.
Great, thank you.
I'm going to turn now to Bob Evans at News Center.
Good afternoon, Dr. Shah. I'm guessing you are aware of the new COVID-19 test kits available through Amazon. They've been approved by the FDA, but do you think people can put their trust in these new tests, or should they continue to go through the testing sites currently available here in the state?
Sure, Bob. So as Bob noted, in recent weeks, the US FDA granted emergency authorization for a saliva-based test that is available through at least one channel, Amazon. The test runs, if I recall, about $100 and change for one, and I think a pack of 10 for $1,000. So it is pricey. Based on what I've reviewed and the data that I have looked at, Bob, the test is reliable. I don't have concerns about that. And given that it can be done at home, it offers certain benefits. You don't need to get in your car, you don't need to drive somewhere, so on and so forth. So, Bob, my view of things of this nature is that we need all approaches. We need all the swim lanes open at once. If that test is one that is financially feasible for you, and the benefit of being at home and not having to leave your home is the right move for you, then by all means. I don't have reason to doubt the validity or accuracy of the results that are generated. But if that cost is unreachable for you, or if going and driving to a nearby swab and send center or a nearby Walgreens for the antigen test is something that's in with reach, that can be done at no cost with equal reliability, particularly the swab and send sites. So Bob, I don't think it's a system where we have to provide preferences to one or the other. All the swim lanes are open.
Okay. And at the last briefing, you talked about testing being down, but if you check the appointments online, available appointments are days out. Can you clarify how testing can be down, but these sites are still very busy?
Well, I don't know if those things are necessarily related, or I don't know if one flows from the other. We know that generally speaking, demand for testing has been high. Keep in mind that there are many different venues through which people can be tested. So Bob, your question suggests that there is an inconsistency, that there's no way that testing volume can be down when appointments at swab and send sites may be 1, 2, 3 days out. For the record, I actually just yesterday took a look had appointments at one swab and send site, and they were available within 24 hours. That being said, there are many different venues in which testing occurs. Testing can occur in hospitals. And if, for example, around the holidays, there were fewer procedures being done, then there may have been less testing being done, for example. So those two are not inconsistent with one another. There may be lower testing that's being done, even though demand at the swab and send sites could be as robust, if not more robust than ever.
Thank you.
I'm going to turn now to Patty White at Maine Public.
Thank you very much, Dr. Shah. We're getting a lot of questions from people who are confused about where they are in line and how they're going to find out when it's their turn, even some people who aren't sure which category they fall under, like school nurses. And, given that we're getting these questions from, healthcare professionals and the general public, I know you don't have all the answers right now, but how is the state going to alleviate this confusion? And you mentioned a registration portal on Monday. I don't know if that might be an answer. It didn't sound like that was necessarily a centralized state system.
So Patty, let me start by saying it is going to take time. Right now, we are receiving nowhere near the vaccine that we would need to be able to offer vaccine across the state in widespread fashion. It is going to continue to take time. And it's not until Maine is receiving several hundreds of thousands of doses every month when widespread vaccination will be something that is a reality. Now, let me be straight with everybody. I know that the one thing everyone wants right now is to know what their number is in line. I understand that. And I wish nothing more than to be able to give you that number in line, because I know that would quell a lot of anxiety about whether you will even get a vaccine or when. Everyone in Maine will be able to access the vaccine, but right now it is a question of when that is. And when that is governed almost entirely by the supply that we get. So that takes us to the question of how will folks know when they've been assigned a metaphorical number in this digital, theoretical, metaphorical line? And how will they find out about it? Well, how they find out about where they are and where they are depends in large part on who they are and where they work, for example, or the type of job they have, or the role that they play in that job. If you happen to work at a large employer, it's probable that you may get vaccinated as part of an employee-sponsored effort. If you are an older individual, you may get vaccinated, for example, as part of your normal healthcare at your doctor's office or at a larger vaccination site, perhaps run by a hospital or perhaps even run by the state. Those plans are under development right now. How we communicate where folks are will happen through those different channels, though. If you, again, happen to be a member of a large corporation or a large employer, a large grocery chain, for example, it may be through the grocery chain that you find out when you'll be vaccinated, in the same way that hospital-based employees have found out. Similarly, if you're someone older and you're in regular contact with your physician, that's more likely to be the way in which you find out. If you're a member of the general public, as I mentioned on Monday, we are working to bring online tools that will help you get scheduled at some of these larger scale vaccination sites. But that tool won't necessarily tell you what your number in line is. It will just help you find a slot once vaccines become more generally available. That's the variable that we need to get clarity on before we can get clarity on where people will line up and where they will be, when they will be vaccinated. Patty, to some of the specifics that you laid out, for example, healthcare personnel continue to remain our focus. That includes school nurses. They are patient-facing and are providing vital healthcare day in, day out. So there are certain categories right now where we have more clarity, but there are others where we simply don't, because we don't know what the supply will look like. Rather than making false promises to folks about when they might be vaccinated, I'd rather wait and assure people that they will have a vaccine, but not make a false promise. When we tell people when they can be vaccinated, I'd rather that be with firmness and clarity rather than speculative.
And beyond an adequate, consistent supply of the vaccine, what is the biggest hurdle to getting more people vaccinated more quickly? What are the pinch points?
Okay, so 80% of it remains the source, the supply of vaccine, Patty. I just want to be really clear. That is really what we need to have clarity on before we can move forward. The other constraint that we are under is making sure that we have systems in place that can accommodate a very large throughput of folks. The surest way to get Maine back on that path to normalcy, whatever normal looks like, is to be able to vaccinate at very, very high throughput. And so what we are working on is trying to design ways that we can take advantage of high throughput locations, be that hospitals, be that other sites that we may have to set up ourselves. If we rely on traditional methods of vaccination, although those are very effective, they will take longer. So the other constraint is being able to accommodate very, very high throughput on the order of tens of thousands of doses every single week. So in order to do that, we've got to have doses, but we also have to have the system in place to make that happen.
So, I mean, I guess, is it both physical space and staffing?
It's physical space, it's staffing, it's traffic control, it's having a system in place where there is minimal exposure at the site of vaccination. It's making sure there's not a line of people wrapped around the block who are waiting in line, because that itself can cause an outbreak. It's making sure that people, when they get vaccinated, have an adequate space where they can wait to be observed, because as we know, there have been a few reactions to the vaccine. If we don't do this carefully, and for example, do what some other states have done, which I respectfully disagree with, and for example, use a drive-through model. We may, for example, have individuals who have an allergic reaction that goes undetected. So we have to have a safe, spaced out place for folks to wait and be observed after they've been vaccinated. We've got to make sure that any system we set up has folks only going in one direction, because when you're having folks face opposite direction, there's a much higher chance for transmission. All of these things have to be set up in advance. We also have to make it such that when you show up at these sites, the time that you are there is as minimal as possible. The paperwork should be done ahead of time. The consent form should be done ahead of time. We should be aiming to have people in and out as quickly as possible, A, because that increases our throughput, and B, because it reduces the likelihood of any transmission.
Thank you.
So to answer your question in a manner that I should have started, after supply, the number 2 challenge is logistics.
Okay, thanks.
Yep. I'm going to turn to Megan at WMTW next.
Thank you, Dr. Shah. At last check on Monday, you said that the variant strain of coronavirus hadn't been detected yet in Maine. I was curious if that still was the case. And the second part of the question is, when you talked about preventing that variant strain, you said it's basically the same way as the strain we're seeing now, but the variant strain is more contagious. So how do you mean more contagious? Is it spread a different way, but prevented the same way?
Great, thanks, Megan. Let me start at the top by saying, please trust me that if we detect that variant strain, that will be part of my affirmative presentation. I won't wait until questions to let folks know about it. We have not detected it yet, and if we do, if or when we do, I will make sure that is front and center in my discussion, not at the back of the line. Let me talk a little bit more about, yes, Megan, as of right now, we have not detected it among any of the positive results that we have seen. Although an increasing number of states now have found it in their populations. Let me talk a little bit more about what you laid out, which is, if it's more contagious, then how will the old methods of masking and social distancing keep us safe? Let me talk about what I mean by more contagious. What we know about this new variant is that, for example, if you take somebody who's got this new variant and another person who's got the regular variant, and you take both of them and you put them in a room with 100 people, none of whom have COVID. After a certain time period, in the room with the people who have the normal variant, I'm just going to make up a number for illustration purposes only. In the room with the 100 people who have the new variant, maybe 10 or 15. Oh gosh, I said that wrong, Megan. In the room with the people who have the old variant. After a certain time period, 10 or 15 of them might have gotten COVID. But in the room with the person with the new variant, it wouldn't be 10 or 15, it might be 15 or 25 people. That reflects the fact that the virus spreads the same way through the air, through respiratory droplets. It's just better at spreading once it gets to the person it's spreading to. It can attach to our cells more easily and commandeer them, causing an infection more easily than the old variant. However, it does not have some magical ability or mythical ability to fly through the air more quickly or more easily than the old variant. It behaves the same in the air. It's just that once it gets to the host, to the uninfected person, it's better able to latch on and cause disease. That's why the old tools of masking and distancing are just as important, if not more important than ever. That all makes sense? Did I get that right? Or is that helpful?
Yes, yes, it
Okay.
makes sense. Yes, thank
Right.
you.
Very good. That's an important point. I'm glad you asked it. It still spreads the same way, but once it gets to the person, it behaves differently. I'm going to turn it over to Evan at the Maine Beacon next.
Hi, Dr. Shah. Thank you. So we've talked about the state trying to reach harder to reach communities with the vaccine. And now that the process is sort of underway, the vaccination process, are there any regions or communities that have so far been hardest for the state to reach with vaccine or vaccine information? And if so, what has been the process for reaching out to that community or communities, and what progress has been made?
Sure. Evan, as of right now, we haven't identified a particular area or community, geography, or group that has been particularly difficult to access. And I say that because early on, starting in our first week of distribution, we took deliberate steps to make sure that vaccine was being distributed across the state. From all the way in Aroostook County all the way down to York County, we were distributing vaccine as from the week we started. And as a result of that, we've seen uptake of vaccine in a geographically distributed fashion across the state. At the same time, Evan, it is still rather early. We are just now in the 4th week of our vaccine operations, halfway through that 4th week. And so it's also perhaps too early to tell whether there are pockets of the state or regions where we have to do more work to reach out to. We're on the lookout for those in our data as we map it out to see where vaccinations are occurring. But as of right now, Evan, we haven't seen any disparities of that nature emerge. It's possible that they will, and we are on the lookout for them.
Great. And then just a second question is kind of a clarification question. Once the vaccine gets to hospitals or other entities that are receiving the vaccines, what kind of oversight does the Maine CDC have at that point over the vaccine and how it's distributed, and how much of that is to the purview of that entity that has received the vaccine?
We've provided the entities who have received vaccine with guidelines around who we ask them to vaccinate. Right now, again, we are still in the thick of 1A. So those who are being vaccinated are healthcare personnel of different stripes, be they hospital employees, home health workers, or EMS clinicians. We give those recipients of the vaccine discretion on in what order, for example, it's best for them to schedule. There are very difficult scheduling constraints here. You don't want to vaccinate all of your ICU in one day, because if they have a small fever after that, then all of a sudden, all of your ICU has got to be out of work. So that staggered approach to vaccinating healthcare staff is something that is very, very important. And we trust the hospital systems, EMS systems, to make those decisions on the order in which they are vaccinating individuals. We provide the parameters around who we would like to have vaccinated in the first group and in the second group within 1A. And then we trust and work with the hospitals to effectuate that.
Thank you.
I'm going to turn now to Morgan at WABI.
Hi, Dr. Shah. First question is about the at-home test, and we were wondering how those results would be logged. through you?
Good. So that's a great question, Morgan. One of the challenges one of the thousands of challenges that have arisen over the course of the COVID pandemic is that many new testing modalities are at home or at the point of care, and thus don't have the regular electronic link up with the state systems that we do with the laboratories that are conducting tests, like Maine CDC or LabCorp or Quest. As new and more testing modalities come online, one of the key questions for us is to work with those manufacturers so that they can report those to us. In this particular instance, I have to check, Morgan, but given that it uses a saliva-based method, that is to say the saliva sample, has to be mailed somewhere to a central laboratory in many of these situations. What can happen is that laboratory can collect those results as they are processing them and then electronically report them, as do hundreds of laboratories. But for other tests, like the antigen test that we have deployed to places like Walgreens, among others, what we've done is work with Walgreens so that they, on a daily basis, enter the reports of the results they've done into our system so we can log them. So it's a little bit of both. Some of them will continue to be electronically reported. Some of them may have to be, based on where they're done, uploaded into our system on a manual basis.
All right, thank you. And oh, I'm sorry, go ahead.
Well, Morgan, I don't want to go too deep in these weeds, but those data are important because I can't tell you what the positivity rate is unless I know the total number of tests done. And if we're only getting selective reporting from different quadrants and different precincts, the positivity rate loses its meaning. So these reports, so we have the total denominator of tests, are really critical. Otherwise, the weight of our epidemiological statistics starts falling off.
Okay, thank you so much. And Dr. Shah, more questions about the vaccinations. My question is, I know that you talked about considering dentists, other qualified professionals to administer the vaccinations. We also had a question from a viewer wondering if, let's say, nursing students at Hudson University, UMaine, et cetera, would be able to sort of help with that. And how would you rate how the vaccination rollout has been thus far in the state?
Okay, so let me take the former. We are still evaluating what our workforce needs will be in order to get these large community-based vaccine sites up and running. We've actually, as to the nursing students, already had conversations for months now. Our team of public health nurses here at Maine CDC has been working with nursing schools and nursing students to get the various paperwork in place so that they can participate as vaccinators. I'm very pleased for that partnership, and we're excited to welcome the nursing students to the table to help us. There are myriad other providers as well, and we're working to determine, again, how we can involve them best in the process. No final decisions there have been made. Morgan, as to your latter question, again, for those who have tuned into these briefings now, this is the 150th one. I'm not a fan of scoring us or ranking us relative to other states. I don't like to make other states look bad. It's just not how I do business. And the same applies with respect to vaccines. But since you asked, Morgan, at least one tracker, one that's being monitored and kept up to date by Bloomberg, has Maine again at the top of the league tables, both in terms of the percentage of our population that has been vaccinated, as well as the percentage of vaccine that's come into the state that's been put into people's arms. I'd like to keep those numbers up. I'm proud of the way that healthcare providers across the state of Maine have responded to the call to help vaccinate. I'm also proud of the uptake rates that we've seen across healthcare providers across the state. My goal from here is to build on that. Can we do better? Absolutely. Can we be moving more quickly? Yes. Can we make sure we do so with equity? 100%. My goal is to keep up the pace and turn up the dial even more. I'm going to turn it over to Patrick Whittle next.
Thank you very much. Just had a couple of questions on this same subject. Is there is there more to be said about the online registry that might be rolled out in the coming days? And I apologize if you covered this a moment ago, but do we know exactly when that's going to be available in the state of Maine?
Sure, Patrick. I don't want to oversell this. What this will be is a website where folks can go and register, find information about where there are vaccine sites available, find a slot that might work for them, and sign up for one, and probably go through the informed consent process online, and perhaps even do whatever billing might be necessary in advance, but I'm not sure about that one, how that module will work. I don't want to oversell this. This is not going to be a place where you go to find your number and where you are in the line. It will be when we have achieved a number of doses that allow us to start this widespread vaccination. It will be the site where you can go and sign up, much like making a reservation at a restaurant or something of that nature. So while we are excited about this as a unified place for folks to go and find a place and a time to be vaccinated, I don't want to oversell it. It'll be helpful, but it's not going to be where you go and put your name in and be given a number like you would if you were at the deli counter waiting for your turn in line. There will also be other venues and places where you may simultaneously be able to find a slot to be vaccinated. For example, if your goal is to get vaccinated at your neighborhood pharmacy, you may go directly to their website, not necessarily through this website. So I just wanted to temper that and make sure I was being straight with everybody about what this will do and what it won't do. In terms of timeline, Patrick, we are working with the vendor right now on some of those last mile contractual issues, making sure we have enough site users and registered users and end user agreements in place. So we're at the last mile. We're hoping to have those contractual pieces wrapped up very, very soon. I've asked our operations team to make this their top priority so that we can start building it out, customizing it for Maine, and then putting it online. I don't have a timeline there. I don't want to overpromise, but please know it's one of our operations and our IT team's top priorities.
So this is a system that sort of resembles a reservation system more than a virtual waiting room, to use an analogy, maybe?
I don't know if there is going to be a waiting room component, Patrick. So what I think you're suggesting is that there could be pre-registration and such that, yep, and I hear what you're saying. It's something we've thought about as well, but I don't know with certainty whether this will allow that sort of pre-registration. I'd have to double check with the vendor. Again, folks who have watched and certainly the folks in the media know, I don't like to oversell. I don't like to overpromise. So I don't know if it will be that waiting room concept that you noted. I think it's going to be more akin to a restaurant reservation as opposed to a pre-registration.
Got it.
Mm-hmm.
And similarly, there have been some isolated reports around the country of venues like pharmacies and healthcare facilities having vaccines that were set to expire and just trying to find some way to use them before they have to be thrown out, because the idea of throwing these out is so unpalatable to so many people. Is that something that's happened in Maine, and is it a common occurrence, or is it just sort of a kind of a cost of doing business kind of phenomenon that has happened here and there?
I can't honestly, Patrick, I can't speak to the frequency or the commonality of that. I've seen those reports too, and how they've had to scramble to go out in the street and find folks. I'm not aware of that happening in Maine, but certainly our directive to those who have received the vaccine has been not a single dose goes to waste. And so I'm aware of at least in one instance, a recipient of the vaccine found somebody who was maybe someone who still patient facing, who might have been vaccinated in a week from now, but they were able to pull them up because they had an extra dose. So certainly our mantra, our imperative is no dose goes to waste, and definitely no doses get expired. But we haven't received widespread, or in fact, even any reports of recipients of vaccines saying, we had to walk down the street to find random people to vaccinate. I think the planning has been such that there has been sufficient demand to meet that supply.
So by recipients, you mean vendors?
No, I actually mean hospitals, EMS systems, and home health agencies.
Oh, okay, I see now.
Yeah,
Right.
and now federally qualified health centers, as well as other outpatient groups in Maine who received vaccine this week.
Got it. All right, thank you very much.
Yep. And the final question of the afternoon goes to Joe Lawler.
Yes, hi, thanks. Just a numbers clarification first before I get to the real questions. I think I heard you say that on Tuesdays you get insight into the following week for vaccine distribution and supply. So do we know what the number of vaccines you'll get next week is yet, or have at least an estimate?
We have the answer, Joe, is not really. We get an initial sense, but those numbers aren't really locked until today at some point. It changes, and hence, the changes we've talked about. What I can tell you is that what we believe we will get next week is almost identical to what we got this week in terms of Pfizer and Moderna vaccines, with the added addition of potentially 100 more Moderna doses this week next week as compared to this week.
Okay, thanks.
Mm-hmm.
And I know there's been a lot of questions about 1B, and everybody wants to know. And I know I heard you say several times that you don't have the whole plan and all the reasons for that. But I'm wondering if there's a way you could even characterize who might be the very first people in 1B. Are you leaning towards any certain groups that might be the very first few thousand or so, absolute highest priority?
At this time, Joe, the answer is we don't have an answer. We've certainly had discussions around whether within 1B, which by the by is about 200,000 plus people in Maine, 209,000 or so, but that depends on which cutoffs you use for different things. We've had discussions about within that very large group, more than 10% of the population, whether there might be some areas, some groups that are, say as with 1A, some groups who we may want to vaccinate first rather than later on in the process. Similarly, that might be by age cutoff. It may be by frontline status, but there again, no final decisions have been made. The reason there is that, as I've noted, if 1B were only, let's just say in a hypothetical world, 1B were 17,000 people. That happens to match the number of doses that we've been getting on a weekly basis. Then we would have extreme clarity into who's in 1B and what their place in line is going to be Monday through Sunday. But 1B is not 17,000 people. It's on the order of 200,000 people. And all we've been getting in Maine to date is about 17,000 doses per week. That means that in any given month, we may get maybe right now at current speeds, 68,000 or so doses in a month for a group that comprises over 200,000 people. That's why having these discussions in a thoughtful way, rather than just throwing the doors open and saying to folks, start lining up around the block, as a couple of other states have done. We don't care if you got to sleep in your car overnight, that's up to you. Just not how we do business. We've got a group of around 200,000 and a supply for the immediate future of around 17,000 per week. We can't simply just say doors are open for everybody, line up where you want, sleep in your car if you've got to. Just not how we do business. We've got to be, and we are being more thoughtful about it. But at this time, Joe, we haven't made those decisions, even within Group 1B, who may be higher and who may be a second.
Okay, and then just finally, a question from a reader. She asks at nursing homes, once staff and residents have received their second dose of the vaccine, will the visitation policies change at that point?
A good question. It's akin to Jessica's question. It's a good place to close out the afternoon about whether there may be changes, for example, in Jessica's case, to the travel and quarantine policy. Same question here about whether there may be loosenings of the visitation. Joe, my answer there is that I'm hoping so. We are eagerly awaiting some data that I know are being reviewed and in process by clinical researchers that will help us get a sense of whether the vaccine, or rather being vaccinated, means that we can start opening up visitation. Some of that will, however, be predicated upon making sure uptake rates in different facilities are high enough. If a particular facility only vaccinated, I'm making up a number, 30 or 40 or 50% of their staff and residents, then visitation poses a risk. If, however, a facility were able to hit 90 or 100% of all of their staff and residents, visitation may be something that's more open. I'm eager to see that come to bear because we have seen firsthand and heard firsthand the outsized toll that this visitation policy has taken on residents of nursing homes. It's had a benefit, but it's also come at a significant and weighty price. We're not blind to that. So once the data support that sort of opening and liberalization of visitation, and once we can say that a facility has achieved the requisite amount of vaccination to make that safe, then we hope to be able to take those steps. We're not there yet. It's a scientific question as much as it is anything else. So Joe, thanks for that question. Thanks to all the questions this afternoon. Before we wrap up, just a recap of where we stand. Vaccination in Maine is continuing apace. Again, as of right now, at least 38,000 people have received a shot of a COVID-19 vaccine. But we know that we've got more to do. We've got more to turn up the dial so that we can start putting Maine back on that path toward normalcy, that return to normalcy we so much crave. As much as I wish I could give everyone their spot in line right now, we're not able to do so. Once we have better clarity over what the supply is, we will be able to start making those discussions happen and giving folks that much craved spot in line. My approach all along has been to give people certainty when we give them advice. Right now, any pronouncement I make would not be worth the paper that it would be written on. Once we've got more clarity, we'll be able to provide you more clarity and some degree of certainty as to when your spot in line is coming up. I ask everyone to bear with us. We know that the wait is the hardest part. The anxiety of not knowing is what makes this so difficult right now. But if it is of any assistance, and perhaps for many it will be cold comfort, to know that there is a spot in line, there will be a vaccine. So the question right now for everybody watching is not whether you'll be vaccinated, it's a question of when. We are working as hard as we can to set up systems to speed that up as much as possible so that when vaccine comes into our state's borders, we get it into arms as quickly as possible. We know that it's not happening at the pace that any of us would have wanted in Maine or across the country. But please know at the same time, we are pushing the federal government to produce as much vaccine and give us clarity around that production while simultaneously setting up systems to get folks through that line as quickly as possible. We know that it's not happening as quickly as it can, but we also ask that you bear with us, recognizing that it will continue to take time. So with that, thank you all for your time this afternoon. Thank you for continuing to submit questions. Please keep those cards and letters and tweets coming. We will continue to answer them as we can. Until we talk again, as always, please be kind, take care of one another. We'll catch up again soon.